All right, you guys, today we're going to talk about the gap. You might be wondering what on earth I could possibly be referring to. Ultimately, it's the gap between men and women around having great sex. So I'm going to take you back a little bit. We work a lot with women around pregnancy and postpartum. And I think when we're in those years of littles and even toddlers and even elementary school, life can feel very consuming, especially depending on how many kids and if you're juggling work as well and just all the things. Women often tell me that they feel touched out, they're overwhelmed, they're not necessarily getting great sleep. They just never really feel like they have any margins or extra bandwidth at all, right? Meanwhile, the men are over here, healthy, late 20s, all through their 30s, feeling good, just sort of wishing they knew how to connect with their wives better or how to help, right? And there's a gap between interest in sex, quality of sex, time for sex, all of those pieces. Then as that goes, so let's just say for this example, women are kind of down here. They're just not as interested, they're tapped out, and men are up here feeling great, feeling healthy, just loving every minute that their wives will participate in, right? And it eventually starts to go like this. So I'm going to fast forward because now we're going to talk about women who are more in their late 30s, early 40s. Maybe kids are all in school. They're not consumed by the wiping butt days and the needing snack arrival every 5 to 10 minutes. And they're just regaining a bit more of sense of self. They're having a little bit more time to themselves and they're getting better and better and better. And there's also an extraordinary phenomenon that seems to happen to women right around age 40, and we just completely run out of F's to give you guys. It's liberating, it's redemptive, it's freeing in the best possible way, where we start to realize that what other people think of us does not matter, and we better figure out what we want and what we care about, and we're longing to have meaning and purpose, and we're not so bogged down in all the needs of the kids every minute of every day. Meanwhile, sometimes men, so now women are climbing, sense of self, more confidence, feeling great, caring about their health, time for themselves. Sometimes men are now starting to have some struggles, right? Whether it's nutritional, it's weight gain, they're coming to their 40s. They also have hormonal changes. Men also have a pelvic floor and things going on. Sometimes there's issues with waking up at night to pee, prostate concerns, digestive colon concerns, ED possibly, and struggles in the bedroom that can now start to erode and undermine a man's confidence and a man's libido and a man's interest. And the interest doesn't usually decline from my experience, but their ability, and obviously if they're having any doubts or questioning how things are going to feel in the bedroom, it just undermines that confidence. So then the gap starts to go like this. And so one thing I've realized in our practice here is that if I'm so passionate about educating on better sex and helping women have more orgasms and better orgasms and all the things, that it would be a massive disservice not to include the partners and husbands. If they're now starting to struggle, that gap is still existing. It might have shifted from here to here, but there's still a gap, which is not great for any relationship. And it's not great for intimacy and connection and amazing orgasms. And so that's the conversation I'm trying to have right now. Ladies, if you feel like you're climbing into your 40s, you're getting a grip on perimenopause and like your hormones, and that can be another challenge, separate topic. But if you feel like all of those things are starting to feel a lot better and click for you, and you're noticing that maybe your partner is struggling, please just know there's help for them too. There's help with pelvic floor therapy, there's help with lots of the factors, and it doesn't necessarily need to involve medications or surgeries or anything like that. That's why I'm so passionate about Shockwave. So we're here for it. We're here to close that gap. That's really what I'm trying to focus on. That's the conversation I'm trying to have with all of our clients coming in. And I've even had a 22 and 30-year-old male this past week who have pelvic floor dysfunction. And when men are struggling, they're often also booted around doctor to doctor, blood test, this test, all these different things, months and months without answers while they're suffering. So back to the no suffering, no settling, and no shame. It applies to men and women, and we want to close that gap.